Very welcome. My name is Sinead McGinley and I'm a research partner in UCD Research and Innovation, and you're all very welcome to the third talk in the UCD COVID-19 seminar series, which is being hosted by UCD Research each Wednesday at 2 p.m. for 30 minutes up until mid-December. So the purpose of this COVID seminar series is really to showcase ongoing COVID-related research that is happening across UCD, across the 6 different colleges, and also to help facilitate greater interdisciplinary collaboration within UCD and also with external partners. And we're delighted today to have our speakers here, Dr. Emma Nicholson and Dr. Therese McDonnel from the School of Nursing, Midwifery and Health Systems. So I'm just going to briefly introduce you to Emma and Therese and their study, and then I'll pass over to them for a 15-minute presentation, and then we'll have time for questions and answers. So Emma is a research fellow in the UCD Centre for Interdisciplinary Research, Education and Innovation in Health Systems, shortly known as IRIS, and is funded under the HRB Applying Research into Policy and Practice Fellowship Scheme. And Therese is an economist working as a postdoctoral research fellow in the school as well. And in February 2020, this year, she was appointed an Evidence Synthesis Ireland Fellowship. So Emma and Therese are going to give us a brief presentation on the key findings from their HRB-funded study, CUPID COVID-19, which assessed the impact of the pandemic on Paediatric Emergency Department utilisation and also the extent of healthcare avoidance during each stage of the public health response strategy. They're also going to briefly discuss a national survey of over 1,000 parents that they conducted to measure the level of hesitancy around accessing healthcare for children during the pandemic and to determine the prevalence and factors associated with healthcare avoidance. Okay, so that's a brief introduction. So I'm going to hand over now to Therese and Emma, who are going to give a joint presentation for around 15 minutes. If you have any questions or comments that you would like to ask our presenters, please feel free to use the Q&A button there at the bottom of your screen, where you'll be able to submit questions. I'll monitor that and we'll have time at the end to pose any questions or comments for Emma and Therese. And feel free to use that throughout the talk. So I'm now going to pass over to Therese, who's going to start the presentation. Thank you very much.
Okay, thank you very much, Sinead, and to UCD Research for the opportunity to communicate our research. And I know many of our colleagues in hospitals have dialed in, so I'm very grateful for that. Okay, so I'm bringing you back to when we conceived our study, some kind of emotional and upsetting photos that were very much in the media when we came up with the idea for this this project, which was late March, early April. There's no doubt when we came up with the idea for this study that the situation that we felt was approaching Ireland in terms of COVID-19 was quite dire, and there was a great deal of fear amongst people and a real concern that hospitals would be overwhelmed. And on the back of that, people were asking questions, it's not all about COVID. So what about those people who need to access emergency healthcare? Are they actually coming forward? So we decided we would leverage off an existing project, which was looking at paediatric healthcare. And because we had such good access to data and collaborations in the various hospitals, we decided to put in a proposal to the Health Research Board to look at paediatric emergency healthcare during COVID-19. So here we are with the research questions that we formulated at this time. So what are the changes in paediatric attendance at emergency departments in Ireland? And what are the likely impacts of these changes during and beyond the pandemic? We also wanted to know, well, what barriers are parents actually encountering as they try to access emergency care for their children during the COVID pandemic? So I'm going to talk to you about work package 1, which is looking at the changes in the pattern of attendance by children at emergency departments. And work package 2, we have carried out a number of interviews with staff working in the various emergency departments. We're not going to discuss that today. That'll be for another day. And work package 3 is the results of the survey that we did of parents nationally back in early June. And my colleague Emma is going to talk to you about the findings of that particular survey. And just at the end of that slide there was actually our project protocol if you want to look in more detail about the project, because we only have time today to go through a small amount. So I'm going to talk to you about some of the findings from a paper that was published back in September using hospital data, and we were given data by CHI Crumlin, Tala and Temple Street, Cork and Limerick University hospitals. And those hospitals, with their data and their cooperation, we were able to look at the pattern of attendance by children in the first 3 months of the pandemic. Okay, so I'm going to ask you to go to the next slide there. That's great. And I'd just like to shout out to, sorry, the last slide there, just a shout out to the many people in the various hospitals who helped support this project. Without their running reports and answering queries and giving us files, this just wouldn't have happened. So we're very grateful, and their expertise, of course. So the next slide, this is a graph from the paper, and it's just one of the graphs in the paper, and I just thought it would give you a good feel for what was actually going on with emergency department attendance for children during the first 3 months of the pandemic. So our study took almost 3 years of data, and we graphed and we analysed the patterns of attendance. And one of the things that we did was we actually categorised the attendance based on diagnosis, and the groupings were along the lines of the potential influence of public health measures. So, for instance, our first category was we called infectious. We were looking at conditions that might be impacted by social distancing, and, for example, the fact that young children weren't mixing the way they normally would be. And the top line in the graph to the right there is that categorization. So that, for instance, respiratory illnesses, many of those would fall in there. The next category was to do with, children weren't participating in sport, they weren't in school, and so the level of injuries were likely to be down. So the next category we called trauma and physical activity. The next category then was personal safety. There was some discussion and some anecdotal evidence we were getting fed back to us that, parents are at home with young children and supervision is challenging, particularly because many of these parents are actually working as well as doing the childcare. So we had a category for personal safety. Then we had a category for, I think the next one is mental health, and it's a very small number of presentations on a daily basis, but very critical that, particularly since some of the supports in the community setting would not be available if there might be a change in attendances there. And then finally, kind of an other category. So largely in this other category, we value the presentations you may not expect to be specifically impacted by the public health measures. So looking at the graph to the right, we're going to look at how that builds up or down, as the case may be, over the various public health stages. So Emma's driving. I'm going to say, go to the next slide, please, Emma. That's great. So on the 29th of February, we had our first case in Ireland, and we moved into what became known as the containment phase of COVID. And if we look at the graph here to the right, which charts attendances in those categories, we can see in that 13-day period, not an awful lot really is changing. Now we're getting to the stage whereby the cases start coming through, and then we move into the next phase, which was the delay phase of the public health measures in Ireland. Actually, I'm going to pause there for a second. Sorry, Emma, if we just go back to what I want to do is just give you a feel for the environment at the time. There was a lot of narrative in the press, which fed into a climate of people being really concerned about the fear to do with COVID, and also that our health system really wasn't going to be able to cope. So here's a quote that comes from News Talk at the time. A leading cancer doctor has warned he does not have faith in the ability of Ireland's health service to cope with the sudden surge of COVID-19 patients. So going back to the images we saw on the earlier slide from Italy and New York and Madrid, we know that our health system is, it has its challenges and may not be as well resourced as some of these other countries. So there was a real fear that, workers in our hospitals were going to be completely overwhelmed by what was coming down the track. And that was the discourse in the media at the time. So if we go to the next slide here, we move to the delay phase. And the delay phase starts with the closure of the schools. And looking to the graph here to the right, this is when things really start to change. Quite literally, when the schools closed their doors, attendance at the emergency department just plummeted across every single category of attendance. And there was also a real concern because of this new virus, and it was highly contagious, that hospitals really did not want patients walking into their emergency department being contagious. So if you looked onto the CHI website at this time, if you had a sick child, you would have seen this notice. If you are worried that your child has symptoms of COVID or flu, please stay at home and contact your GP. So completely understandable, very contagious disease. So there was this climate, we felt, that parents probably really were looking left and looking right, and they weren't sure where to go with their children. And here's just another quote from the press at the time: coronavirus, Ireland, hospitals braced as 50,000 may need critical care. So, it was certainly a very alarming discourse at the time. So then we went from the delay phase into the mitigation phase. And the mitigation phase is when, I know they didn't want us to use the term lockdown initially, but that is what it was, and that's what we all came to call it. And looking at the graph here to the right-hand side, the mitigation phase, which went on to the 17th of March, we can see most categories of presentations actually aren't really changing. So they hit their lowest in the beginning of the mitigation phase, having plummeted in the delay phase. And the only category that we actually see increasing at this stage is the actual trauma and injuries category. But even that said, even at its highest at this stage, it's about 60% down in prior years. Because if you think about the time that we're dealing with here, this is April, May. This is when the weather is good and children are out and about, and in normal times they're participating in sport. So much as there's some level of recovery, for want of a better word, in that category, it's still way down on prior years. So then we just have a quick last slide here from me. Thanks, Emma. Just move to the final slide. So then there's a recap slide, just going through some of the key points that'll come up now in a second. And this slide will tell you that really we saw a very significant decrease across all categories at this time. One thing we also saw that I hadn't time to cover here is huge drop in referrals from GPs, which is not surprising given the focus of their work at that particular time. Is there evidence of avoidance? Well, yes, there is actually. Most of this is completely explainable. So, you know, how people were living meant that this is really explainable. But I think we might have lost Emma there. I'll try and pick it up now in a minute. But we did look at what we called complex chronic conditions. So these would be presentations for things like diabetes and cancer. And they're hard to track because there's so few presentations in those categories, but we were able to see that throughout the phases, particularly in the latter part in the delay and mitigation, the presentations for those reasons seem to have dropped. Now, we don't know if they're being diverted directly to specialist services, or were parents not bringing children in who had symptoms that might have been concerning at that particular time. So that's it for me. So I'm going to hand over to Emma, and she's going to talk to you about the survey.
Great, thanks, Therese. Apologies there. I was having my own technical difficulties there. So hopefully everything goes okay for the next few minutes. So I'm just going to talk about the survey. So as Sinead gave a very good introduction to what the survey was looking at. So we're looking at avoidance behaviour and also hesitancy about accessing healthcare, really both during that delay or mitigation phase or lockdown, and then at phase 1 of reopening. And then we were interested in looking at what were the factors that were maybe associated with that avoidance and hesitancy. So we did a cross-sectional survey of parents of children under the age of 16. So it was a little over 1,000 parents took part, and data collection took place from the 5th to the 10th of June. So it was around that, just as we were starting to come out of the restrictions. Just to give you an idea of what it was that we were looking at in the survey, we collected demographic information, and we also collected some health information. So that included whether or not their child had a pre-existing condition, or whether or not there was a pre-existing condition in the household. We asked them about their attendance of health services during COVID and whether or not they avoided health services. We asked them about hesitancy, both during that lockdown phase and during the current phase when data collection took place, which was phase 1 of reopening. We also looked at potential reasons for avoidance or hesitancy. And then we also measured stress using the stress subscale of the depression, anxiety and stress scale. So in terms of accessing healthcare, 34% of the sample stated that they did require healthcare for their child during the pandemic up to that time. And 22% of that sample said they decided against seeking healthcare even though they felt their child required it. And when we looked at some of the reasons as to why maybe they were avoiding, you can see from the graph there that those who attended healthcare did report a greater concern that their child would contract COVID-19. However, those that avoided healthcare were more likely to state that the service, or they thought the service was needed more by others than themselves and their child. So then we were also interested in where people were getting their information from and looking at the reasons to why they are potentially avoiding healthcare. It was very promising to see that the majority of patients or of parents stated that they used HSE and government sources to access healthcare or to access information about the
Just lost Emma there for a second. Hopefully she'll
Shall
jump back.
Shall I maybe keep going?
Yeah, absolutely, if that's okay. Great.
Okay, so we'll see how we go
nature
here.
of these Zoom webinars.
Yeah, so here was a source of information. So as Emma was saying, that the key... Oh, you've got it.
Sorry. Sorry, did I freeze there?
You're fine. You just froze for maybe 30 seconds. If you want to just talk about that.
Sorry, I'll jump back. Apologies, my internet is decided to act up today.
You want to turn off your camera maybe, Emma?
Actually, I will.
Sometimes helps with the connection.
I will.
Just in case.
Hang on, stop video. There now. So as I said, the majority of it was promising to see that the majority of parents said that they used official government and HSE sources to access information about the pandemic. And also when we asked them about their potential concerns about accessing healthcare, the majority of people stated that they had a fear about contracting COVID, but also about 30% said they feared the emergency departments would be very busy and they'd have to wait very long. And then about 20-25% stated that they thought the service would be needed more by others and that they would be judged for actually using the emergency department during the pandemic. And then as you can see in the orange there, just under 20% said that they believe the government advice was to stay away from the health services during that time. So in this graph here, you can just see the levels of hesitancy that were reported from the parents, both during that lockdown phase from kind of late March into April, and then during phase 1 in early June. So as you can see, parents stated that they were much more or somewhat more hesitant to attend health services during that initial lockdown phase. And then similarly, during phase 1, that reduces quite substantially, and you can see that they're less hesitant to attend, or they're more willing to attend health services during the phase 1. So obviously that's, as the situation was improving and as I think we were all adjusting to this kind of new reality and new way of living. So we also conducted some regression analyses to try and understand what are the potential factors that might be contributing to this hesitancy. So these are some of the factors that emerged as significant in that analysis. So as you can see, women were more likely to be hesitant. And also stress was a contributing factor there. So those who reported mild to moderate stress were twice as likely to report being much more hesitant. And also those who reported severe and extremely severe stress were more likely to be hesitant. And then interestingly, what we found was those who stated that they believed the government advice was to stay away were also more likely to report being hesitant to attend lockdown. And this is attend health services during that delay in mitigation or lockdown phase. And then we also carried out the same regression, but using the results about hesitancy during the phase 1 of reopening. And we found that once again, stress is a contributing factor, both mild to moderate and severe and extremely severe stress. And once again, that those who believed the government advice was to stay away were twice as likely to report being much more hesitant to attend the emergency department and health services. And then due to that finding about that kind of maybe understanding that public health advice meant that you shouldn't attend health service, we were interested in figuring out maybe what was contributing to that. So we carried out a logistic regression to look at the responses to that question. And really the main factor that was significant in this was stress again. So once again, parents who reported mild to moderate stress were 1.7 times more likely to be to think the government advice was to stay away, and that also was relevant for those who reported severe and extremely severe stress. So some of the key findings there from the survey really were a third of the participants required healthcare for their child. However, 22% of these decided not to access healthcare. And as I said, while the majority of parents reported using government sources and official sources for information, the results suggest, particularly the results around potentially those who believed government advice was to stay away, it would suggest that maybe the public health guidance was misinterpreted, and that when you were told not to be going out and about and to stay in your home, that included accessing health services. And then as you can see there, stress was also a significant driver of hesitancy and of that misunderstanding. So really one of the key findings was it's very important for public health messaging and the health services to make sure that people are aware that they do remain open, because it is, you know, as Therese pointed out earlier on, there can be, you know, significant consequences in the delay of seeking healthcare, particularly for children. And I think it's really, really important that it is communicated clearly to parents as the pandemic progresses. So in terms of next steps, we are continuing to collect monthly data from our hospital, and we're monitoring the trends of attendance at the emergency department as the pandemic progresses. I'm particularly interested in maybe the impact of the schools reopening and, you know, this second wave that we're in. And then also, as Therese mentioned, we've just completed some interviews with staff, frontline staff from the emergency departments across our 5 hospital sites. So great. Thank you.
Okay, thank you very much, Emma and Therese, for a really interesting presentation on the key findings of your CUPID COVID-19 study. So what's really interesting, I think, is you know, I suppose the interpretation of public health advice and the impact that that had on accessing emergency care. And what will be interesting to see is kind of what the long-term implications of that will be in terms of people's healthcare needs. The fact that they weren't accessing, you know, emergency departments with severe issues during that time. So we have around 5 minutes now for questions or comments to address to Emma and Therese. So as I mentioned at the start, if you have any questions you'd like to ask, please do submit them in the Q&A. I might just start off if that's okay. Emma and Therese, if you want to turn back on your cameras if they're stable enough so people can see you, that would be great. So I just wanted to ask you, I suppose, were there any unexpected or kind of findings that you hadn't anticipated? I mean, obviously you had your hypotheses starting the surveys and the analysis of the data, you know, and there were some kind of maybe anticipated findings, but was there anything that maybe surprised you during the analysis of the data?
Therese, you're on mute there.
For me, looking at the data, I was really surprised at how quickly, as soon as the schools closed, the attendances plummeted. So the speed at which they plummeted was quite surprising. Also, mental health presentations, they were down. Now we're going to be looking at those as the months go by, and I've seen a bit of an uptick already, certainly looking at more recent data. So, you know, that dialogue about the impact of the restrictions and perhaps not accessing other, being able to access other services, and now with the return to school, we are going to be keeping quite a close eye on the mental health side of things, which is largely to do with the teenage population.
Brilliant. And we actually have a comment in from one of our attendees here saying that the studying the reopening of the Tallaght Hospital and the impact of co-location with adult services would be interesting. Is that something maybe that you might be looking at in terms of kind of pediatric emergency department access and maybe kind of adult services?
Yeah, I mean, that's a really good suggestion, and I've just been speaking to our colleagues there yesterday, and we're getting data from them now again since they reopened. I think there was only 3 presentations in August, but we'll be getting September data in. So I think there's a lot that can be done to look at that's quite a big change, the delivery of service, the closure and reopening then of Tallaght.
Mm-hmm. And we actually have another question here from the audience. So is there any plan to look at similar pediatric attendance in primary care or in GPs?
We would love to, and we're doing a project accessing primary care at the moment for looking at the impact of free GP care for the under 6s. But we are really struggling to get data from GPs because they are overwhelmed at the moment. So even a fair number of those who had signed up for our project are really just not able to give us the time at the moment. So, but we would like to go there on that front. But again, it's just, you know, they're just so extremely busy.
It's feasibility, really, yeah.
Yeah.
And I mean, it was quite interesting that you managed to survey over 1,000 parents in a very short time period of just a few days. And the wealth of data that you've captured and analyzed in such a short period of time is extremely impressive. So congratulations. And what are the plans? I know you kind of briefly touched on it there, Emma, the plan. So you'd applied for a 12-month funding from the HRB Rapid Response Call. So what are the kind of the plans for the rest of the 12 months, or, you know, what do you hope to do with the remaining data? I think Emma's frozen there again. Oh,
apologies, no, I froze there and I missed that. I might turn my camera off again because I did have, it was better if I had that off. Sorry, could you ask the question again?
No, actually, yeah, no, I was just asking what the plans were. So this was obviously a 12-month funding project. So I was just wondering kind of what the plans were for the remaining period, because you've obviously done a huge amount of analysis in such a short period of time.
Well, as I said, we'll be monitoring the trends in the emergency department attendance as time goes on. And we've also just completed the interviews, so we're analysing them. I mean, I think it will be very interesting to revisit the survey now that I think, you know, we recognise now this pandemic is a long-term issue. You know, we will be kind of facing this for the next 6 to 9 months, I think, is what they're proposing. So I think looking at maybe potential changes and as people adjust to this new way of living will be very interesting, and seeing, I think particularly as well as the public messaging starts to change, because that was something that was very prevalent, that there was a misunderstanding, a potential misunderstanding of the public health messages that meant you shouldn't attend your emergency department, even though they remained open.
Mm-hmm. Brilliant. And we've just got 2 more questions that have come in, so we'll very quickly try and answer them, and then we'll wrap up, because I'm conscious we started a few minutes late because of the technical issues. So we have a question that's come in. Have you any recommendations for ways to proactively tackle potential drop in attendance with the second wave? Maybe there needs to be improved clarity around the government advice that's being communicated, and there's probably going to be a lot of learnings from this study in terms of how people understand, you know, government or public health advice around attending EDs.
I think so. I mean, one thing I noticed when you look at the 5-level system, there's no mention of what remains open. Everything is about what is closed and what you can't do, and, you know, the restrictions. Yet there still doesn't remain, and there's no information that, you know, health services will remain to function as before, and that emergency departments and GPs all remain open as before. And I know there was a bit of a push towards the end of March, as Therese had highlighted in her slides, that there was a bit of a media blitz to say that, look, the emergency departments are open and you should attend if you need to. But that still doesn't seem to have kind of filtered into the public health messaging, and that when you look at the levels, there's no information about what you can still do or what you should still do if you need to. So that I think that would be very important, to make sure people are aware that those services do remain open.
I think also some of the personal stories we're seeing coming out, used to show people how serious COVID is, are very effective. So whether we need to have a kind of a drive to show personal experience of how, you know, comfortable you can be accessing emergency departments with your child, because they are very much geared up to this, so that if you have reason to be concerned, that you do turn up. And so something maybe visual, etc. So I suppose there are ways of reaching people who may not be dialing into or paying attention to the briefings, NEFIT briefings, or reading the Irish Times or whatever. So there's been some really effective infographics and campaigns done elsewhere that I'm sure can be applied to this particular question or concern.
Fantastic. Okay, thank you very much. I'm just conscious that we're just past 2:30. So unfortunately, we've run out of time, but thank you very much to all of our attendees for joining us today, from those in UCD as well as people that have collaborated on this project in the different hospitals. So thank you very much for taking the time to join us. I'd also like to thank our speakers, Therese and Emma, for taking the time to present the key findings from their fascinating Cupid COVID project. So thank you very much for the time in preparing that and answering our questions. Just before we finish up, I just want to quickly mention our next talk. So next week's presentation is going to be on the Wednesday, 21st of October at 2 p.m. We have Professor Wim Meyer from the School of Biomolecular and Biomedical Science. He will be presenting on his SFI-funded study, Surveillance of SARS-CoV-2 in Sewage to Gauge Prevalence in the Community. And this is a really interesting project that you've probably heard a lot about already. It's been received a lot of media coverage, and he's going to be presenting findings which hopefully will provide very interesting and valuable data to epidemiologists to assess whether public health mandated measures are effective. So that'll be a really interesting talk as well. So again, thank you very much. Apologies we didn't get to answer every single question. And thank you again. And we look forward to seeing you at future UCD COVID-19 seminar talks. Thank you very much, everyone. Thanks, Therese and Emma. Thank you.